Welcome everyone to Medicus. This is Varun. I hope you're all doing well. On 20th of October, it is considered as the World Osteoporosis Day. No, this is not another pandemic. This is a medical condition, of course. And in order to discuss about this medical condition, we have Dr. B. Leela Prasad. Dr. B. Leela Prasad, he's an orthopedician as well as a spine surgeon from Visakhapatnam. He's got 20 years of experience in this line of business. Welcome, Dr. Leela Prasad, sir. How are you doing?
Yeah, thanks. Thank you. Thanks, everyone. So, good
Great.
afternoon, everyone.
Thank you, sir. Good afternoon to you too. Silence represents peace. At the same time, silence has another side of an angle as well that is also scary and horrifying. When I was doing some research, Leela sir, I was actually scared to know that osteoporosis is considered as a silent disease. Why is it called as a silent disease? And why is it named as a silent disease, sir? I'm really scared when I actually heard about it.
Yeah. See, in general, any disease or any disorder or anything, it manifests itself. So, by way of some symptoms, any fever or pain or anything. But this osteoporosis, it progresses or it develops and progresses in the body without any obvious symptoms. So, usually, unless you test for it, it is not really evident. So what people are unaware that they have osteoporosis, but in fact it keeps on progressing in them. So since it's not obvious, so it's called a silent disease. In fact, it's
Oh,
even called as a silent killer.
oh, okay. But I mean, this is even more scarier to know this, sir. But what is this osteoporosis, sir? I mean, can you explain us why is it called osteoporosis? What happens in our body with this medical condition?
So yeah, porous is the literal meaning of porous is weak and osteo is bone. So it's literally means weak bones. So in fact, what happens is in layman terms, osteoporosis is nothing but brittle bones. The bony structure becomes weak. The amount of bone in your the amount of bone matrix, bone substance decreases. So hence the bones become brittle. Brittle in the sense they are more fragile and they're more prone for fractures. For bone to fracture, you need some injury. So what happens in osteoporosis without any injury or with a simple or trivial injury like if you have a cough or if you sneeze or when you are going in a vehicle, if you have a speed breaker, such small incident can fracture your bones.
Oh my God.
So this is what happens in osteoporosis.
And all this happens silently, and you will only realize after you encounter a fracture or a broken bone
Yes,
or
yes.
something.
So
Oh my God. This is.
when you recognize osteoporosis, when you have a fracture and you have pain to the fracture.
By the
So
time
that
the
is,
damage is done.
yeah, by the time the osteoporosis is fairly advanced and the complication has occurred. So this is
Okay, okay.
you come to know of the disease only when the complication has occurred. So
Oh,
that is why
okay.
it's called the
Sir, I
silent
have some
disease.
research papers with me. There are some research papers I have with me, sir, and these research papers are actually telling me in America, there are about 10 million people who are already suffering with osteoporosis, and there are 44 million people who are suffering with low density. And in
Correct.
India, there is a report that is stating that there are 66 million people who are already suffering with low bone density, which may lead to osteoporosis. Are these numbers scary? What are we doing right? What are we doing wrong? Why are these numbers so big?
See, this is to some extent due to the inherent risk factors. For example, the Asian race. The Asian race are more prone for osteoporosis compared to other races. Asian race,
Okay.
which includes India and all, they are more prone for osteoporosis. And the aging population. So coming to the risk factors, some risk factors are not modifiable. So we cannot do anything about it. For example, race. We can't change our race. Being Asians, we are all prone for osteoporosis. Age.
Okay.
As we age, we are more prone for osteoporosis. We can't decrease our age. And gender, female gender, they are more prone for osteoporosis. And like short stature, most of the Indians are uh,
Not in
little
height.
short in height. So short stature, they are more prone for osteoporosis. So and some lifestyle and all these things. So we are inherently more prone for osteoporosis. And these numbers which you have quoted are in fact true.
Oh, okay. Sir, I'm just a little curious now. I mean, this is a fairly new medical condition, and we have been Asians since generations. We have been having the short a height probably in the last 100, 150 years, I would say. We don't know about what was the height of our ancestors 100, 150 years ago. Why is this medical condition now prevailing and now alarming?
See, it was there from before, but just
Okay.
that we have recognized it and we have treated it, being treating it as a medical condition. We are more aware of it. Not that it was not there
Oh,
before. It was there from
oh,
before. It is there from ages.
oh. Okay, but it was not recognized or given a
It
name
was
like
not
an
recognized and it
osteoporosis.
was
We
not
didn't
given due
have.
importance. It was
Okay,
not
and we
given
didn't
due
have.
importance.
Okay, so we didn't
What
have the
was like,
scanning
uh,
mechanisms.
and it
Okay.
was just considered as a normal aging process.
Oh, okay, but in reality,
So
this is a medical condition.
we
Hmm.
accepted it as a normal aging process. Whereas we fail to recognize it as medical condition. Now that we have more awareness and more diagnostic facilities, and people are more aware, so this is coming to it's been more popular among people.
Okay, sir, can you tell me who needs to be careful? Because who are more prone to get this medical condition, osteoporosis? So that helps them to understand what should they do. We'll talk about that next.
Yeah. So who should be more careful? Those who have the risk factors. So as I've told you, there are modifiable and non-modifiable risk factors. Non-modifiable means they are inherent risk factors. There are five non-modifiable factors. One is the age. As you grow older, you are more from osteoporosis, female gender, family history. So if you have a parents who have an osteoporotic fracture, if you have both parents who had an osteoporotic fracture, you are at more risk for osteoporosis. Similarly, Asian race, short stature, they are more prone for osteoporosis. And coming to lifestyle, people who have a sedentary lifestyle, people who do not have exposure to adequate sunlight, who do office jobs, like who are in high altitudes and more into desk jobs, who work more in AC rooms, closed rooms, and all. They are more because they have less exposure to sunlight. Then people who are smokers and who drink on a regular basis, for example, if they drink more than 2 packs a day, the chances of osteoporosis increases. And
Okay.
and people who have some medical conditions like say inflammatory bowel disease, kidney disorders, and this arthritis, rheumatoid arthritis, and the people who are on chronic drugs, who are on long-term steroids, who are using medicines for epilepsy. Now all these people are more risk for osteoporosis, so they need to be more careful and be aware.
Right, right. Sir, I also have one more study I would like to discuss with you. So this osteoporosis as a disease, I actually, was referring to my notes, sir. This osteoporosis as a disease has affected a lot of older aged women who are in their post-menopausal, age. Is that right, sir? I mean, is that
Yeah, it is
also a
definitely.
fact?
Yeah, it is true. It's a fact. The reason being, this estrogen. Estrogen is a it's protective hormone as far as the bones are concerned. So it prevents bone loss. So what happens at menopause is the estrogen levels come down. So
Mm-hmm.
the estrogen is less. So the protective effect of estrogen is lost. So that is why osteoporosis is more common in females after menopause. So that is after the
Okay.
age of 45, 50. Osteoporosis is more common in males. I mean, it's more common than in females. It is more common than males.
Right, right. So according to what I understood based on your explanation and and everything else, osteoporosis is a medical condition that decreases the bone density, due to which even a smallest of the movements can trigger into a
Major
breakage
fracture.
or into a fracture of the bones. Okay, I understand. So how do we know, sir? How do we know that if my bone density is appropriate or no? How am I going to know? Through scans? Do we have any scans
Yeah,
available?
correct. So if you fall in any of these factors which I mentioned, you can always go for a scan. So the accurate way of measuring your bone density is the DEXA scan. So
Okay.
earlier they were doing by doing it with ultrasound. But ultrasound is not very accurate. So the most accurate way of getting your bone density done is a DEXA scan. DEXA scan gives you the T score. So that is the
Okay.
accurate way of getting your bone density.
Right. So that was the scan. I just read about it, sir. I mean, I was just about to ask you that question. There is a article that was written by one of the doctors in the US. I mean, of course, I mean, nowadays, for each and every medical condition, there are scans, there are tests, there are ultrasounds, there are that have that are crossing the rooftop in terms of the pricing and everything else, the cost and everything else. Now, how does an individual, because this is definitely a medical condition that needs to be treated and public needs to be aware of it. How does anyone, any public or any human being should get convinced that, hey, this is an important scan that you need to get it done. It is not a scam. It is not a medical scam. It is a necessary scan that you need to get it done to ensure that you don't fall for osteoporosis. How should I be aware of it, sir? Because just like anyone from when we talk about from rural places, when we talk about elders, they feel that these doctors will write unnecessary scans to me. These hospitals will tell me to go get scans for the sake of it. If I just take rest for a few days, it's going to be all right for me. But how do we convince them that hey, it is important? This scan is not a scam. How do we tell them, sir?
So this is a common misconception. Anyway, there are two sides of it. As you said, scams or maybe they do happen. But see, this DEXA scan is not for everyone. It's not for everyone. Say, for definitely not for a younger individual. So less than 50, it's a strict no. As only those who are only those who fall on the risk factors only. I mean, those who are having the risk factors, definitely we go for a scan. But once if a patient sustains a fracture, so if he has a spine fracture or a hip fracture, so these are with a trivial fall. So if he has a major injury and he has a fracture, that is a different issue. So that is because of the injury. So if he has a simple fall and he has a hip fracture, so that means his bones are weak. The
Okay,
fracture itself is a hard evidence that he has osteoporosis.
okay,
So
okay, okay,
so if a person is walking, so 60-year-old male is walking and he has a simple fall in his bathroom or wherever, and if he has a hip fracture, that itself is an evidence that he has osteoporosis. So we need
okay,
not confirm it by taking a scan. We do a scan to monitor the progress, to see
okay,
whether his bone density is increasing or not. So
okay,
in that case, we don't do a scan to confirm his diagnosis. So if he had a fracture, that itself means he has osteoporosis. So that is
okay,
confirmed.
okay,
So
okay.
when we treat his fracture, we treat his fracture, not only his fracture, but we treat osteoporosis basically to prevent further fractures.
Okay, okay, got it. So when
And
you're
once,
saying, sorry, sir, please
yeah,
continue.
once we start treatment, whether the bone density is increasing or not, that we quantify it by a scan. So we
Okay,
just can't say we are giving treatment, your bone density is improved. To have an objective evidence that the bone density is increasing, say from -2.5 to -1. So we need some objective evidence. So that objective evidence is given by the scan.
okay. Sir, how expensive is this scan, sir? I mean, where are these scans available? Are they readily available in all the diagnostic centers?
In all the major diagnostic centers, they are readily available, and it is not very expensive. It costs somewhere between 3,000 to 4,000.
Okay. And how is this scan done? It's like an X-ray kind of a scan, or is that a
It's an
blood
X.
test?
It's an X-ray.
Okay, it's an X-ray
X-ray
kind of a
is
scan.
X-ray. It's basically an X-ray.
Okay,
So it's
okay.
done at three places: at the hip, spine, and wrist.
Okay. Sir, you kind of mentioned because we have been hearing about a lot of medical conditions after COVID. A lot of people, whoever is watching our audience, as well as including me, have done a lot of research during that leisure time of 1, 2 years of COVID and understood a lot about a lot of other medical conditions also. Half knowledge and Google knowledge for that matter. However, what I want to basically understand is this medical condition reversible or irreversible?
See what we can do. See osteoporosis, the bone is a living tissue. So osteoporosis bone is it's continuous remodeling process. Old bone is broken down, new bone is being formed. So there's
Oh, okay.
always there's all bone is not a static tissue.
Okay.
So there's a lot of changes. It's a dynamic process. So whenever the balance between bone formation and bone loss is disturbed, that is, the bone loss is more, then we move towards osteoporosis. So what
Oh,
happens in childhood is until the age of 20, bone formation is more than bone loss. So your bone mass builds up. After 20, the sort of bone formation decreases a little. And at 30 and early 30s, you achieve what is known as peak bone mass.
okay.
So at early 30s, you achieve your peak bone mass. Thereafter, bone loss is more. Bone loss is more than bone formation. So you gradually keep on declining your bone mass. So that,
Okay.
and if it declines beyond a certain limit, that is when osteoporosis occurs. So basically, to prevent osteoporosis, you either need to increase your bone mass or decrease the bone loss. Okay. So now
Okay.
coming to prevention. So the best thing to prevention is to increase your bone mass. And the best way to increase your bone mass is be active when you are young. So start exercising at a young age. So when you
Okay.
start exercising at a young age, your bone mass builds up and your bone bank balance builds up. So if you have a very high bone mass, so even if you lose it in later ages, you still won't fall below osteoporosis, that line, so that red line. And next is to prevent bone loss. And even to prevent bone loss, exercise is the single most important factor. So one
Okay.
is you should do weight bearing exercises. Weight bearing exercises meaning walking, jogging, cycling, dancing, sports. So all these exercises which you are weight bearing, which you stand and do, or these increase your bone mass. So osteoporosis is not like you wake up today and all of a sudden I want to prevent osteoporosis. It doesn't happen. So it
Okay.
starts right from your childhood. Okay,
Okay. 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 So, I
and
mean, for those,
yeah,
please go ahead,
yeah.
sir. So, for
And your
those
lifestyle.
people,
Yeah.
yeah, so for those people who probably have missed that opportunity to build their bone mass or bone density from the childhood, right?
Correct.
And now probably they do not know whether they have their bone density less or high. Can they at least start now? They may probably in their late 30s or early 40s or maybe in their mid 40s also. Is it too late for them? They
It's never
cannot do
too,
anything?
it's never too late. See, once you miss the early bus, so next thing you can do is to prevent bone loss.
Okay,
Again, there is never a late age to start exercising.
okay,
Okay, even
okay,
exercise if you start later also, it always prevents bone loss. So
okay,
the
okay.
effects of exercise are many. One thing is it improves your muscle strength, it improves your balance, it loads your bones, so that again the bone loss is prevented. Once your balance improves, your tendency to fall decreases. Okay,
Right,
most of the
right.
falls are because of loss of balance.
Okay, okay.
Okay.
Sir, how expensive is this treatment for osteoporosis? Sir? Because this seems to be like a, of course, at least for me, this is a new medical condition, and I'm sure for a lot of our public, this is a new medical condition. Probably when they go to a hospital, when they had a fracture, or probably when they had a breakage of a bone for a small, slightest of the, because I heard about this condition from one of my colleagues in my office as well, right? So he was actually taking his bike out. He never realized that his toe was bent a little bit. He was fine. He came back to office. By the time he went back home and opened his shoes, his leg was swollen. His feet was swollen. The little finger. When he went to the hospital, he was told that it's a fracture. There is a hairline fracture. Even now, I don't think so. He realized, or someone told him that it is due to the bone density issue, sir. So, uh, uh, what should they do? Should they go back to the hospital again and get a test done for bone density? Will that help?
Yeah, definitely. But the most common fractures of osteoporosis are one is the spine fracture, the hip fracture, and the wrist fracture. So as I told you earlier, if you have these three fractures, if you have a simple fall and you had a hip fracture, that means you have osteoporosis. So you don't have, I mean, you don't need to do any further tests to confirm it's osteoporosis. The fact
Okay.
that you had a hip fracture or a spine fracture or a wrist fracture with a simple injury means you have osteoporosis, and you should start treating not only the fracture but also the osteoporosis. So what
Okay.
common mistake people do is they end the treatment with the treatment of fracture. So they get treatment for the hip fracture or they get surgery done or whatever, and they stop treatment. They think it's cured, but the real problem starts now. So once it has fractured, the chances of further fractures are high.
Okay. Okay. Sir, this treatment for the osteoporosis. So, what does this treatment protocol include, sir? Because fracture, everyone knows it since ages. We know what kind of treatment, plaster of Paris, or it could be some crepe brand, or some, medicines and all. But is there a treatment protocol for osteoporosis? Maybe you can also give some information about the diet that we should follow or the supplements that we should take.
Yeah, it starts from lifestyle changes. So try to be as active as possible. Quit smoking. Reduce your alcohol intake, and you should take adequate calcium, adequate vitamin D. And if you are say not exposed to sunlight, there's no harm in taking calcium supplements, no harm in taking vitamin D supplements. So now after this, and then there are definitely medications for osteoporosis. There are medications to decrease the bone loss. So these are called bisphosphonates. They should be taken on a long-term basis. And most people take it for about say 2 3 months and then they stop it. So this is not of much use. So you should take them on a long-term basis. This
Okay.
bisphosphonates. And again, to
Okay.
build up bone mass, there are injections, and these are what you call denosumab injections. So they should be given every 6 months, and these
Right.
definitely go a long way in increasing your bone mass. And there are
Right.
injections called teriparatide. These are hormone injections. Again, they have a very beneficial role in increasing the bone mass. So it's an entire spectrum. It starts from lifestyle changes, dietary modifications, then treatment for fracture. Treatment for fracture would be, so if it's knee fracture, it's a definite surgery. So if it's a wrist fracture, it can be managed with a POP, or for the blast of Paris. But if fractures usually do need surgery, otherwise patient becomes bedridden.
Oh.
And prevention of further fractures. These go from medicines to injections.
Okay, okay. Sir, you just mentioned about one medicine. I actually did one small research about that medicine also, sir, bisphosphonates.
Yeah, yeah.
So I was actually stunned to know that this is one of the important medicines that is given to for the osteoporosis patients, and this medicine has very high side effects. Again, this is again all this whatever I've been telling you is from the research that I've done for this particular medical condition. But how can anyone, or is are you saying that this medicine is going to cure osteoporosis? However, patients should also be careful about the side effects of this medicine and should be taking some other precautions to ensure that they don't fall into those side effects.
Yeah, correct. So this, I mean, any medicine would have side effects. Whether it's a simple paracetamol or anything, would have side effects. But
Yes.
for these medicines, there are definitely precautions. See, in this bisphosphonates, there are guidelines for taking these medicines. They should be taken on empty stomach. They should be taken with a glass of water. The common side effects are you have this gastritis, you have vomiting sensation. Now, all these side effects can be avoided with proper usage of the medicine.
Okay.
Okay,
Okay.
and you should not lie down for say half an hour after the medicine.
Okay.
And,
Okay.
and the serious side effects are you can have thigh fractures, you can have this thigh bone fractures, femur
Oh.
fractures, and you can have jaw problems.
Oh my
So
God.
whenever these are, of course, they do occur, but they are relatively rare. So
Okay.
you should always, if you are having dental problems, you should always inform your doctor that you have a dental problem. And what's usually done is, if you have no other go than using these medicines, you use them for 2 to 3 years and you take a break. So this is called a
Right.
drug holiday.
Okay.
So and this is how you can reduce the side effects. So you take them for 3 years non-stop, and you go break off say say about 6 months or a few months break. So this drug holiday helps in decreasing the incidence of side effects.
Okay, okay. Thanks, sir, because that's very important because especially we have been hearing a lot of these side effects related problems. Combiflam recently, there was a study saying that combiflam may actually create some side effects for you. During the COVID time, a lot of people have taken these combiflams and Dolo 650s on and on and on. So that's why I asked this important question to ensure those who are undergoing this osteoporosis treatments, they should also be aware of the side effects and also how do they
Definitely.
make sure they don't fall into those side effects as well. So, not just about this osteoporosis, you are an orthopedic surgeon as well as a spine surgeon. Since my childhood, or probably since our childhood, we have been hearing about this vitamin D. We all know where to get this vitamin D. There are a lot of content, there is a lot of information available online how to receive this vitamin D naturally and artificially. Most common thing what everyone talks about is sunlight,
So,
right? Some of them say morning sunlight is only helpful for vitamin D. Some of them say evening sunlight. Some of them say no, no, no. Go in the hot sunlight and stay for at least 1 hour. I've recently heard this as well. After you stand in sun and come out, don't take shower at least for 2 hours so that the vitamin D should be absorbed into the skin. So amidst this all this complications as well as this information overall, what do you recommend, sir, as an orthopedic, as an actual person to talk about this topic?
see, let us be practical in this. Say, if you ask someone to go in the hot sun, it may not be practical, and especially when everyone is working. So you are say from say 10 to afternoon 3 is your working time. You can't take a break and just stand in the sun. So whenever it's
Yes.
practical for you. So best thing practical would be early morning. So every early morning everyone would be free. So go for a walk or just go out in the sun. And this about this having a shower, that's definitely a misconception. There is no science in it. So it's just a misconception. And have an exposure to sunlight whenever it's feasible for you.
Okay. Okay.
That's as
Great.
simple as that.
Great. Thank you, sir. Sir, finally, what would you like to say to our audience about this osteoporosis as a whole, as well as an orthopedic surgeon?
Yeah, as I've said, there are some things which we cannot modify, the non-modifiable risk factors. Those things which we can modify, we should work on that. So, and they are very simple. They are not expensive. You don't have to pay for them. Simple things are be as active as possible, exercise as often as possible, maintain a healthy lifestyle, take a balanced diet, take adequate calcium. If you're taking a balanced diet, obviously your calcium and vitamin D requirements are taken care of. Avoid smoking, reduce or limit your alcohol usage, and
Great.
be as active
Thank
as possible.
Absolutely. Thank you, Dr. Leela Prasad, sir. And ladies and gentlemen, osteoporosis is a medical condition that you need to be watching out. This is a medical condition that has been there since generations. However, we have never realized it. You must be having a lot of cases around you or even in your family that even a small fall or even a small movement may have resulted in a fracture or it could be a breakage of bones. This could be osteoporosis. Get a bone density test done. It is available in all the major diagnostic centers. We have doctors like Dr. B. Leela Prasad available in Vishakhapatnam area. Those who are interested can go visit him in Haima Spine and Ortho Clinic, which is in Maharani Peta. You can type it in Google and you can find him there. And you can also find him on our website, Medicus. You can type in Medicus in Google and you would get our website as well as our app. You can download our app. You can get a consultation, nothing wrong because a stitching time always saves nine. On this note, I would like to take a leave and reconnect with another important topic which helps all of us. Once again, thank you so much, Leela Prasad sir. Namaste.
Yeah, thanks. Thanks.